Hi, now I will be talking about diverticulum in esophagus. Now, what is this diverticulum? This is outpouching from the mainstream of mucosa and wall of esophagus that is known as diverticulum. Now, the diverticulums are classified into various types. One is known as pulsion diverticulum. In pulsion diverticulum, this is developed because of increased force inside the esophagus. This increased force in the esophagus is usually seen in repeated diffused esophageal spasm. It is also seen in hypertensive lower esophageal sphincter. So whenever there is increased pressure inside esophagus, there is outpouching of diverticulum from the wall of esophagus. This is known as pulsion diverticulum. This is because of increased pressure inside the esophagus. Sometimes there is some tumor inside the esophagus, and because of that, pressure in esophagus is increased, and as a result of that, diverticulum is formed. Another one is known as traction diverticulum. Now, this traction diverticulum is formed because of pulling effect from outside whenever there is any pathology in mediastinum, any fibrotic pathology, any inflammatory pathology which pulls the wall of esophagus outside, that is known as traction diverticulum. So these are the types of diverticulum. Another type of diverticulum which is present in pharynx is known as Zenker's diverticulum. This diverticulum is because of defect in the pharyngeal muscles, and this defect is present since birth. So in these cases, there is formation of diverticulum in the pharyngeal region. A huge diverticulum is usually formed posteriorly in pharynx because of the potential weakness in cricopharyngeus muscle. Now these patients of diverticulum, how they will present? This depends upon again the position of diverticulum. In cases of Zenker's diverticulum, this particular diverticulum is present in pharynx. So in these cases, these patients, they complain of dysphagia stage 1, that is, they will complain of sticking sensation in the pharyngeal region. And many a times there is regurgitation of food material which is lodged in the diverticulum, in the diverticular sac of Zenker's diverticulum, and this food material comes out, it regurgitates out, and patient will recurrently spit the food material which is lost, which was taken, which was consumed 2 days back, 5 days back, that will come out. There is foul odor in breath, and this foul odor in breath is because of fermentation of food material which is present in the diverticulum. Many a times these patients, they complain of pain in the neck region posteriorly. Many a times they complain of burning sensation in the pharyngeal region. So these are the features of Zenker's diverticulum. Suppose if diverticulum is present somewhere in mid-esophagus, then again it depends on the size of that diverticulum. How much big is the diverticulum? If the size of diverticulum is big, then in that case patient may complain of dysphagia. In these cases, sometimes the diverticulum is of that size that will compress esophagus from outside and produce some degree of obstruction, as a result of which patient will complain of dysphagia. The food material sometimes gets lodged into the diverticulum of esophagus, and there is fermentation of that food material. These patients, hence, they complain of burning sensation in retrosternal region. So overall, the diverticulum presentation is in this type of way. Now, how to investigate these cases of diverticulum? Now, the diverticulum is usually diagnosed by barium X-ray and CT scan of chest region. Barium X-ray is the old method of diagnosing a diverticulum. Its sensitivity and specificity is round about 70%, but in case of CT scan, sensitivity and specificity are almost about 95 to 100%. So diagnostic is CT scan of chest. In these cases, endoscopy is to be done in order to rule out other causes of chest pain, other causes of dysphagia. So, in the cases of diverticulum, though it is rare, but it may be patient may present with diverticulum in this way. Thank you.